Uh, can anyone hear my voice? Am I audible to everyone? Just give a message in the comment box so that I can understand. Okay. Thank you very much. So let's start our today's session. I'm Dr. Abu Talha bin Fakhrul from Bangladesh. Today, I will conduct a session on IPS and communication skill regarding UKMLA Part 2. So, our today's motto will be empathetic, be a good listener, and be safe. That is the point of today's discussion. So, I'm Dr. Abu Talha bin Fakhrul. I have been graduated with MBBS from Bangladesh, and right now I'm GMC registered it at NHS UK. So, first of all, let's discuss our today's marks distribution of each station. All right. Okay. So, in case of that, what we want to discuss is that there are actually basically total marks are 12. Okay. So, in case of 12 marks, data gathering, technical, and assessment skill has 4 points. Clinical management skill has 4 marks. And on the other hand, the rest, like interpersonal skill, that is also has solely 4 marks. All right? Are you listening to me, everyone? Okay, okay. Just give a comment. Mm, okay. Okay, so let's tell it to you again. That is actually in case of the marks distribution in UKMLA Part 2, total there are actually 12 marks. Okay, so in case of 12 marks, it has interpersonal skill. It solely has 4 marks. Data gathering, technical and assessment skill solely has 4 marks. And on the last but not the least, clinical management skill has 4 marks on its own. So as you can see, as you can see from the point, actually, uh, interpersonal skill has 1/3 of the total marks distribution. On the other hand, if I tell you like this, like you have performed very well, you have performed very well, you understand very well, you see everything very well. You see, sorry for the disruption. You have given your best for data gathering, technical and assessment skill, and you have given the best management. But your interpersonal skill was actually not there in the station. You were not emotionally, empathetically, or sympathetically, whatever you say, not connected with the patient. Then you can get only 3 out of 12, even though you have given your best shot in case of data gathering, technical assessment skill, and clinical management skill. So that is the point where interpersonal skill has the greatest value. So this is the most vital, most important, and the most vital part of UKMLA Part 2, because solely it can determine whether you can get a good marks in the station or whether you will fail. It can identify that. So always give your best emphasis on interpersonal skills and improve them, develop them as much as you can. So let's go to the other side. There are some do's and don'ts by GMC in case of UKMLA Part 2 for interpersonal skill. For example, let me tell you, uh, you know, you are sitting in front of a patient and you are talking to the patient. The patient didn't get much scope to uh, cooperate with you, to share his or her feelings, to share his or her opinions. Okay, that means all over the station, you thoroughly told everything, but there was no scope of the patient to tell any single word. This is actually highly discouraged in case of UKMLA Part 2, because you should not do that at all. There are some etiquettes and manners in case of just sitting in front of the patient, in front of the examiner, how you will enter the room. Whenever you were, let's start from the beginning. For example, you have gone through inside the hall, you are waiting outside your station room. So whenever the bell has been rung and you're about to enter the room, don't open the door and enter. First, knock on the door and open the door and tell, may I come in, sir, please? That's an etiquette. Okay. So what it will help you, it will get you good marks in case of IPS. Just whenever you sit in front of the patient, don't move your body so much. Don't move your body so much. Don't jerk your legs, move your legs so much that it can be odd to the patient or it can be odd to the examiner. So these are some kinds of do's and don'ts that should not, that whatever you need to follow and whatever you don't need to follow. So you should abide by these things. Whenever you practice with your partner, you can get accustomed with these things, like how to answer any question that you don't know very politely, how to refer a patient to another colleague, another consultant, or another hospital in a very professional way, how to deal with angry patients with your highest professionalism. These things are being assessed in case of UKMLA Part 2. So must remember all these things. Okay. So an interpersonal scale. Talk less, listen more. Yes, this is the main bullet point of interpersonal skill. Whatever you need to do, you always talk less, give a floor to your patient to talk to you, to share his or her opinion, to ask you questions so that you can answer more. Whenever you listen more to your patient, you can answer more and it will help you to increase your interpersonal skills scores. Okay. So what I have already shared, that start from knocking the door to going out of the room. All right. So again, another thing is, I am sorry is not enough. Okay. You need to feel it. For example, a patient came to you and he or she is actually complaining of some kinds of some medical error. Some medical error has happened and he's actually complaining. Okay. So you were telling the patient, okay, I heard you and I'm sorry about this. If you say like this, that you are sorry, the patient won't feel that you are really sorry from your heart. So whenever you are telling the patient that you are sorry, you should at the same time express from your heart that you are feeling it from yourself, that you are really sorry. And that is actually, you need to act like that. And don't overreact, overact. Okay, sometimes people overact. Sometimes they tend to cry. That is not actually at all acceptable. Okay, obviously you will say sorry, and you should express your feelings that you are really sorry, but in a professional way. Okay, so IPS basically consists of approach, rapport, open and close-ended questions involving the patient, demonstration of professionalism, understanding ethical principles. Okay, so approach means how you enter the room, how you sit in front of the examiner and the patient, how you approach a dummy for examination, how you approach to the patient more sympathetically and empathetically. Rapport is all about you need to build a connection with your patient. Okay, that you were emotionally connected with the patient. That is rapport. That you are in such a position and patient can tell you everything freely and frankly. That is all about rapport. Open and close-ended question. That is a more important thing. Whenever you are starting your station, always start with open-ended questions. Okay, so what is actually open-ended question? Open-ended question means like I'm telling the patient, okay, you have come, I know you have come here with headache for last 3 days. So can you please tell me more about it? Okay, that is actually open-ended question. If the patient doesn't tell you in detail, then you need to ask specifically. That is close-ended question. Okay. For example, does the pain move to somewhere else? Do you have any other associated symptoms? For example, any nausea or any vomiting, etc. That is actually when you are narrowing down to a specific point, that is actually close-ended question. Okay. So in case of these, you need to involve the patient. That means you should not only ask the question, you also need to get the answer coming from the patient right away. Demonstration of professionalism is actually all about the station, all or everywhere in the station there is professionalism. You need to show your professionalism, your whatever you are emotional, you are sympathetic, empathetic, but definitely in a professional way. Okay, and understanding ethical principles. Obviously, for example, you are in UK. UK has a ethical guideline. They have some ethical principles, some rules and regulations, and you need to understand that and also make the patient understood about the ethical principles, what you can share and what you cannot share, what the patient can know and how much the patient cannot know. These things are in case of ethical principles. Okay, so IPS actually, whatever I told you before, it actually dominates the overall 12 marks in real. Okay. As I already told you, you can take a very good history, excellent history. Yes, it is. You have given the best management, but your IPS is actually very poor. So in that case, in spite of giving best management, taking the best history, you can get 1 or 2 out of 12. This is the practical scenario in case of UKMLA. For this reason, many doctors fail. Many doctors fail, unfortunately. So must focus on interpersonal skills. Whenever we practice with our partners, we sometimes forget how we should express, how we should answer in a polite, in a professional way, and how we should express our approach and attitudes towards the patient, in which situation which is appropriate. So these things are very much necessary to understand, because if you don't practice in this way, then it won't be grown up in yourself, ultimately resulting in failure in the exam. Okay, IPS is not something that, always must remember that IPS is not something that it will grow just in one day. It takes a long time to be built up in a doctor's mind. Okay, so must and must, whenever you are practicing, focus on your interpersonal skills, focus on record your sessions and try to listen how you have delivered your answers to the patient. Were you actually empathetic to the patient? Did the patient actually get his or her flow in your interpersonal skills? So focus on these things. Okay. So judging IPs in prescription station. Okay. So in case of prescription station, there is one thing that uh, sometimes we think that in case of prescription station, there is no interpersonal skill. It is completely false, because there are some etiquettes what you need to follow in case of prescription station. Whenever you are entering inside a prescription station, you must act, I repeat, you must act that you have opened up the specific page of the drug that you are writing, the specific page of the antibiotic, that and specific dosage of the antibiotic page that you are writing in your prescription. You must and must remember that. Okay, you must act that in that way. You must open the BNF and open that specific page. You need to try to act finding out the page. Don't act just open the specific page you have memorized. If you do so, it can fail you in the exam. And if you don't open up the BNF, it can fail you in the exam, definitely. Okay. So there are some other things in case of prescription station. If the prescription comes with real patient, then there is so much to do with interpersonal skills, so much more to do with interpersonal skills. So must and must focus yourself, focus on the interpersonal skills, and try to develop yourself with these kind of attitudes, this kind of manners, behaviors, your approach, your body movement, your way of watching towards the patient, way of seeing, way of nodding your head. These things are very much important in case of interpersonal skills. Okay, so rapport. Rapport means you are building a connection with your patient. What does connection mean? Connection means whatever you are telling your patient, does he understand? That is one, number one. Does he understand? Does he actually listen to whatever you are telling him? Are you very much speedy, or does the patient want you to be a little slower? Okay. And any questions that the patient has, he or she wants to ask you. And if you are giving him the floor to ask the questions, that these things are in the rapport section. Okay. So you can ask these things are like, in case of rapport, are you listening to the patient? When the patient is talking, are you interrupting him or her? uh, in your conversation, is it a dual conversation, both-sided? For as a result, for example, whether your patient is involved in your conversation or it's a one-way conversation from you. These things are very much mandatory. Are you addressing the concern? For example, a patient told you that that his father died of cancer. Okay, that's a very big concern. And in case of your conversation, in case of history taking, or in the management, or in the diagnosis part, are you really addressing it? Or if the patient asks you in case of data gathering, will I have any diabetes? Whenever you are giving telling him the diagnosis part, telling him the diagnosis, before telling the diagnosis, are you really addressing the patient's concern? These things are very much mandatory. So must and must remember these things. Okay. So it's about how you say it and what the patient wants to know. That is all about rapport. So next thing, How to build communication skill? Uh, in case of communication skill, what is very much needed, that is actually giving a pause. Giving a pause in case of your delivering your answers. Okay. For example, I'm telling my patient, okay, you from the conversation we had, and from examining you, also assessing your investigation reports, uh, I'm suspecting there could be something serious. Give a pause. Give a pause. Let the patient absorb what you have told him. Then tell the second part. Whatever you are suspecting, this could be that. Okay, in a very professional and polite way, emotionally. You need to be emotionally connected. Active listening. Active listening piece, when the patient is talking to you should not interrupt the patient at all. He's whenever, in case of data gathering, history taking, it can happen that uh, you ask the patient, can you please tell me more about it? And he told to you near about the whole history of the thing, whole history of the situation in 2 to 3 minutes. In that case, you need to pick up the important clues and then use it in your data diagnosis and management part. All right. Summarization. Summarization is before giving the diagnosis. Okay. So in case of these things, don't ever just stare at the patient and listen, answer. Sometimes you need to nod your hand. Sometimes you need to tell, okay, go on. All right, carry on. Uh-huh, I see. So you can use these kind of phrases when the patient is talking. All right. So it will assume that you are really listening to the patient actively. That is very important. Acknowledge. Acknowledge means uh, if the patient has any relative, if the patient has any mother, if there is a mother, if there is any minor patient, you should acknowledge that thing. Okay. So in case of assurance, you can tell like, don't worry, or you can tell, we will try our level best. Please bear with us. These kind of phrases. Always learn to appreciate. Okay, when the patient told you about a concern, try to appreciate it. Like, I really appreciate your concern, so let's find a solution for this. Social things you can ask about the patient, and always remember about eyes. That is idea, concern, and any expectation. Always do eyes is very much mandatory in case of IPS, because if you forget to ask eyes, then it can happen that the patient may you can just get a very average mark if you miss eyes is very much important, because if you don't ask eyes, you can never know what is the concern of the patient, what was the main concern of the patient. If that thing happens, probably the patient could have some more things to know from you. Whatever you are giving the management, patient may not know, might not want to know about that. He or she might want to know about something else that you didn't give the that you didn't answer in the station. In that case, your marks will be very poor. And last but not the least, always safety net about in case of every station. Always safety net your patients. Okay. So Uh, there is another thing. From top to bottom, consultation tips. In case of consultation tips, whatever I can tell you, like eye contact is very much mandatory. Whether you are looking to the patient eye to eye, make eye to eye contact, eye to eye contact. Okay. Your tone should be up and down, sometimes up, sometimes down, sometimes up, sometimes low. Your tone should be like that. If posture means whenever you have sometimes for example, you have entered a station and you see that your patient is standing, so will you sit in your chair at that moment? Never ever do that. If your patient is standing, you must start the station in a standing position. If your patient is sitting, you must start the station in the sitting position. Okay. Your hand and body movement should be little, but not too much. But you need to be very much empathized, and you need to act like it is real. You should express with your voice, with your eyes, with your facial expression, everything else. You need to be confident about whatever you are telling to the patient. Okay. Do not assume like, okay, it could be this, it could be this. Don't ever tell like that. Always confident, be confident in your answer. Okay. That is more important in case of giving management. As I already told you, you should pick up both verbal and non-verbal clues. What is non-verbal clues? For example, you entered in the station, you started greeting the patient, and you see that the patient is touching his or her forehead. So if he or she is touching his or her forehead and doing like this, you need to pick that clue. That means probably there could be some headache or any pain. So pick up other non-verbal clues. Okay, this is very much important. That means you are really engaged with your patient. Pick and talk, and always start and finish consultation with open question, not closed one. Okay. For example, tell me more about your pain. As I already told you, is there anything else that I might have missed? Is there anything else that I can help you with? Tell these things of phrases. As a result, what can happen? Sometimes it can lead you to the specific diagnosis. For example, uh, you have taken the history, but still you didn't find any clue what could be the diagnosis. Yes, it could happen that probably you have missed to ask a leading question in any part of the history. You have missed to ask a specific question that can lead to this diagnosis. You have missed it. It can happen. It's very natural. So if you say at the end of history taking that, okay, so is there anything else that I might have missed? If you ask the patient like this at the end of taking history, that means data gathering, then what can happen? The patient can help you in this case. He or she then can give you a clue that you have missed to ask. It happens in the real exam. So they can help you in that if you ask these kind of questions. All right, must remember that. Flow. Flow means you need to maintain the sequence. Layering means you need to answer the diagnosis or the management layer by layer. Whenever you are telling the management, for example, okay, you have, in case of breast cancer, there are some options. Give a pause. Patient can ask, what sort of options? Then tell. There could be surgical management. There could be non-surgical management. Then give a pause. The patient will ask you again, I want to know about the surgical options. Then give the management about surgical management of the breast cancer. So this is layering. Layering means breaking the whole management into some parts, small parts, so that the patient can understand and he or she would lead you to the specific part, what he or she wants to really know in this station. All right. Another thing is signposting. This is another important. For example, to start a next point, to talk about insensitive matter, you can give a signpost. Signpost means whenever you are leaving a section and starting another section, you should just give a little title. For example, you have taken the MAMF, you have asked the MAMF, and now you are about to ask DESA. So before asking DESA, you can tell, so regarding lifestyle, how about your diet? Do you exercise regularly? Sometimes this condition, you can, in case of asking sexual health related questions, You can give a signpost like this. For example, sometimes this condition is related to sexual health. It might sound a little bit intrusive. We can stop at any moment if you want. So by any chance, are you sexually active? This is actually the signposting way. You can talk in your own way. That's not a big deal. Big fact is whether you are signposting or not. Two-way conversation, I already shared with that. Bridging in telling diagnosis and management and seeking feedback in management. So what happens in here, whenever you are telling the diagnosis and you are telling the management, it shouldn't seem that they are not connected. You need to make a bridge between that. How? For example, okay, you have got breast cancer. So in case of breast cancer, we have some management options. They are surgical and non-surgical. This is the bridging. Okay. So always make a bridge and tell in a bridging way between diagnosis and management, and seek feedback. Okay. For example, you have told that there are two options like surgical and non-surgical. What do you want to know first? Which part do you want to know first? The patient can tell you, I want to know about surgical option, or I want to know about chemotherapy. I want to know about radiotherapy. Then tell about that part. You don't need to discuss about the other parts at all. Okay. Third person, always in case of confidentiality issues, psychiatrist stations, use third person voice, he or she. In case of refusal station, always give a reasoning. Why you are giving this, and in case of giving what you are taking, answer like this. Okay. You need to give both medical and non-medical solutions. Okay. But it's actually not always needed. As I already told you, if the patient wants to know a specific part of the management, they can lead that way. You don't need to cover the other alternatives or the rest of the management. You don't need to do that at all. Whatever the patient wants to know, answer that first. And if you can't answer the rest of the management, medical, non-medical, whatever it is, it's actually not a big deal. All right. Okay. So that is all about our today's session. So thank you very much. So apart from that, if there are any questions, you can ask in the comment section. Any question? Any question from you? You can ask freely in the comment section and I can answer. Okay. Uh, mhm. How do we know when to examine the patient and when to verbalize? Okay. Actually, in case of every station, you should verbalize that you want to do a general examination and you want to do the specific examination, whatever the station is. You should verbalize in every station. All right. But how do you know when to examine the patient? You can know it in two ways. Either there will be written that examine the patient outside the station, or it cannot be written, but whenever you enter the station room, you can see there will be a dummy of anything. It could be a hand, it could be abdomen, it could be genital organs, it could be chest, anything can be there regarding a dummy. If you see a dummy, then you can know that yes, it's a combined station and you need to examine the dummy. Okay. We never actually examined the human patient. No. Actually, it's not at all needed to examine the human patient, but yes, sometimes there will be no dummy, but you need to examine the real patient. Sometimes it can happen. Okay. If it is written examine the patient outside the station, but you see there is no dummy inside the room, but there is the real patient, then you need to examine on that patient. When you are about to verbalize, then your examiner will give you a clue. Please proceed like this. Please, like this. So then you can examine the patient. Yes, when there is no model, you should verbalize. Okay. Thank you very much. Any other questions so far? Mm-hmm. Any questions from anyone? Thank you very much. I'm Dr. Abu Talha bin Fakhrul from Bangladesh. If you have any more queries in the coming time, you can just let me know. That would be very much appreciable. And always be with Med Institutors. Thank you very much, Med Institutors, to arrange this today's session. It's really very much. I'm really very much honored to present this presentation in your Facebook page. Thank you very much, Med Institutors. Any other questions? Probably there are no questions right now. So if there are no questions, then we can end our today's session here. And thank you very much, Made Institutors, again for letting me to give a presentation today from your page. And I really appreciate for and give thanks to everyone who joined today's session. Thank you very much again.